Okay. Can I start? So, good afternoon, ladies and gentlemen, and welcome to this special session with Visit Health in association with Niva Bupa Health Insurance. And today we are going to talk about solutions on chronic diseases. So, I am Dr. Prakhar Singh, and I am a internal medicine physician by background, and I practice critical care and advanced cardiac and trauma life support. So, I am going to guide you through what are the problems that are faced by people as chronic disease, what is the value of fitness, and how are we going to deal with this in the upcoming future days. So, why fitness is important? Primarily, fitness is important because of the physical health benefits: stronger heart, stronger lungs, better immunity, weight management, stronger bones and joints, and improved energy levels. So you have to understand that when we are talking about fitness, it is not merely absence of disease. It is complete mental, physical, and social well-being. So you see on the second point that it also has mental and emotional benefits. It reduces stress and anxiety, the sleep is better, it boosts confidence and self-esteem, and it also creates sharper brain function. You might have noticed people come across that they are lethargic, they are not active, they are irritable. All these are problems with poor fitness, and the long term benefits are it prevents chronic diseases like diabetes, heart attacks, and many more. It slows down aging and also improves the quality of life. So we need to understand as human beings that fitness is a wholesome, it's a wholesome effort that goes into your body, and we should not take our body lightly because our body does give a lot of warning signals, and when the warning signals are consistently ignored, it leads to the more complex disorders like heart attack, stroke, and so on and so forth. Now, obesity, as we know, is one of the leading problems in the world. India is en route to become the diabetic and obesity capital of the world, and we are just few cases behind America now, which is currently the number one country with the maximum number of diabetes and obese patients. But obesity is one of the leading factors which cause diabetes, dyslipidemia, risk of cancer, mood disorders, heart diseases, liver diseases, blood pressure problems, and reproductive disorders. However, all these problems that are listed as a consequence can lead to obesity and also can exist independently from in non-obese patients. And do you know that most common cause of fatty liver is actually non-alcoholic fatty liver? So we have to understand few things here when we are talking about chronic diseases is our utilization of sugar, our management of stress, and also our management of our daily fitness. Now, if you ask me a question that is a person who's obese, should they always be considered unfit? So that is not always the case. See, weight is one of the parameters that determines your fitness. However, there are patients who may be, overweight by their, body habitus, but they are very, very fit. They can run, they can walk, they have full agility. They can also have very, sharp reflexes. So many examples are there across the world, but that is one out of many. So, as a collective disorder, we always consider that obesity, diabetes, hypertension, and all such chronic disorders are synonymous with an unfit patient. So when we are looking at one of the leading causes of poor fitness is stress. Often you may come across patients who are having decreased energy levels, who are feeling increasingly irritable, who are having trouble sleeping. They tend to wake up whole night. They're not able. They sleep during the day. They're not able to focus on their work. They are having difficulty listening to communication, and so many things are there. Hence, it is important for us to understand that are they stressed out? When we look at the stress profile of such patients, we have seen that the stress levels of such patients are so high that they are not able to cope up with their daily life events, and in that case, they start developing a sense of discontent, a sense of what we call as detachment from the world. And stress is the modern pandemic. We have to understand the value of stress, whether it is loss of work life balance, whether it is long working hours, working night shifts, or utilizing too much of your time on the desk. So whenever you are, so if you are, a employee or a person who is experiencing such symptoms, this is the time you should seek help, and help has to be professional. Not always can you confide in your friends and family because the opinions might be biased. So we have to understand the utility of professional help here. Now, what is the solution? The solution is easy to talk about, but very, very difficult to follow. And the problem is, it is just like, making buying a gym membership on the 1st of January. You want to go, you try to go, but after the 31st of January or even before that, you quit because you lose motivation. Now, a healthy diet routine is not a very difficult thing to follow. You can have fruits in your daily routine, proteins in your daily routine. You can avoid carbs and fats as much as possible. But many, many times we just, relentlessly take, health for a ride, and we consume high carbohydrate, high trans saturated fatty acid food. Hence, having a healthy diet routine is one of the first steps to building a good, fit body. And what should be the diet? So, the diet has to be 30% proteins, 50% of carbs, and 20% of fats. Now, how do we measure it? If you're using the Visit app, you do have a food login. You can log in your food, measure your proteins, carbs, and fats, and also the calories that you're intaking. So, if you ask me, what is a good calorie intake? So, for a normal, healthy individual, usually working around 8 to 10 hours a day, doing about a workout of around 30 to 35 minutes, the calorie intake should be close to around 2200 to 2400 kilocalories. But if you are, let's say, a homemaker, or maybe if you are, on a desk job, the calorie intake comes a little down from 1800 to 2000 calories. So it is easy for you to measure. Then comes the important part, which is exercise. What is good exercise? So, for an example, if you start walking 10,000 steps in a day and you walk it across the day, so like you are working for 8 to 10 hours, you're in the field, and in those 8 to 10 hours, you are walking 10,000 steps. Is that called exercise? Right? So if you do have access to the chat, please do you keep writing your comments on the chat so that I can also read and answer them. But technically, that is not exercise. The exercise means a concentrated effort. 10,000 steps in 1 hour, that's a concentrated effort. That's about 4 kilometers of walk. If you are in the age group of 25 to 45, don't just go for walks. Do aggressive exercise. Go for jogging, go for Pilates, go for yoga. Yoga, and that too a little bit of, strong yoga, like power yoga. So try to burn as much as possible in your early years. There are times when people feel that, oh, I'm just 25. I don't need to exercise right now. Maybe when I'm 30, when I'm 35, I will do it. But we tend to forget a very important concept in life. What you sow, so shall you reap. The thing is, If you do not work on your body in the early 20s, your body will not respond the way you want in your late 40s. So if I have anybody who's, young, dynamic, early 20s, late 20s, try to work on your body now. Male, female does not matter. Everybody needs a fit body. So it is important that you focus on your health patterns from day one. And I understand that there might be, pressures of finances, work, relationships, and so on and so forth. But your body also demands your time. Your body needs you. I coach, thousands of people every month. And out of those 1000 people, let's say 15% or 20% remember my effort and work on that. I feel I have done something. And this is what I want to do to you. Let's say we have 100 listeners today, or maybe 1000 listeners today. Let's see whether we can attain 100 to 150 listeners to, do a strong regimen for themselves. Wake up at 6 o'clock. Have your breakfast by, let's say, 8 o'clock. Reach office by 9:30 or 9, whatever your timings are. 10. Work relentlessly for 6 to 8 hours. Have good lunch and a small break in between. Drink at least 3 liters of water during the day. Even if you are sitting in air conditioned offices and not having enough thirst, you should drink 3 liters of water every day. And then eventually you go on to finish your day with a light dinner and sleep light. So in India, we have this really bad habit of eating a very heavy dinner, and that leads to a lot of fat accumulation because you eat dinner and you go to sleep. So if you have a light dinner, the sleep will also be better. It will be lighter. It will be more freshening. And when you wake up in the morning, you will have the urge of eating a heavy breakfast, which is going to be your heaviest meal of the day. Okay. So once you've done this routine, you will automatically want to do some exercise. Now, this exercise can be pre dinner, it can be pre breakfast, but it should be not on a full stomach. So you should not eat and do an exercise. Always make sure that you want to do an exercise before any heavy meals. And the exercise could be anything. People ask me a lot of times: Is Pilates better? Is yoga better? Is the other thing, like gym better? I say everything is the same. It's all a means to uplift your body. It's all a means to make sure that your body stays strong and healthy. The only problem is people do start on time. Every 1st of January, I see a rush in the nearby gyms and parks wherein people are motivated that okay, this is the new year and a new me. But the problem is motivation. People cannot stay motivated for that long. It is important and imperative that we understand the utility of a good motivated routine. Now, how do you motivate yourself? It is important to understand the utilization of friends and family here. Always make sure that you have a gym partner or a fitness partner who is as enthusiastic about fitness as you are, and eventually motivates you and you motivate them in return. And once your motivation has succeeded, the 3-month challenge, wherein it takes 21 days for a habit to be formed, and then it takes 3 months for the habit to be sustained, and then what you need is determination to carry this on forever and ever and ever. And let me tell you, if I were to incentivize you for your health, you would definitely work towards it. Like, let me give you an example of a really, really fit superstar, Akshay Kumar. At the age of 60, 65, they look so young, they look so fit. Look at the muscle, the skin tone, the vigor, the energy. But if I were to pay you, let's say 5 crore rupees for your fitness, I'm sure you're gonna do it too. So the problem with us is staying motivated because we're not incentivized to maintain our physique. Our partners just accept us the way we are. Our friends accept us the way we are. So we are not incentivized to have a great routine, right? Hence the lack in determination. That's why always try to reward yourself or reward each other. Make some good friends who are enthusiastic about fitness and then reward each other. So there are certain pillars of wellness. When we are looking for pillars of wellness, we do see that the importance of daily routine. A daily routine is non-negotiable part of the day. It is important to understand the utility of the daily routine. Like you have an office which runs 9 to 7. That's how you have to ensure that your daily routine is also made. Then sleep is important for every professional. Our main problem is that we do not sleep on time. Let's say we are sleeping every day late at night, 1 o'clock, 2 o'clock, and so on and so forth. It is important for us to understand the value of sleep. If we are not sleeping on time, the body is not recovering. Now, what people ask me, what is the ideal time for sleep? Now, as per WHO, the ideal body recovery time is from 10 to 3 o'clock, 10 p.m. in the night to 3 a.m. in the morning. But generally in India, because we are having late dinner, we generally tend to sleep late, like let's say 10:30, 11, 12, and we tend to wake up by 6, 7, or 8. And that is why our recovery time is a little slower than Western population that generally tends to sleep by 8 or 10, right? So this is as per WHO's data. I can share more data links after the end of the session. But we have to understand the value of sleep. Now coming to diet and nutrition, it is always required to make wise choices. See, you do not have to stop eating your food. That is the worst thing that you can do to your body is starve the body. So don't stop eating food, just change your choices to much wiser choices, like replace fat with protein, replace snacking behavior with nutrition. Like you can like if you get protein bars, then the protein bars can be used instead of burgers and pizzas to gain good nutrition as a snacking behavior alternative. And as I mentioned before, movement, movement, movement. Move as much as you can. Okay. Now, tips to improve the health: eat sufficient healthy food, drink enough water, reach out to your colleagues and community workers, and use strategies that work for you. So many a times I get such cases wherein there is some random diet that you see on the internet. You see something called as a crash diet or a GM2 diet, and eventually I say, why would you want to do this? Why would you want to use it? Because those diets are not for regular people. Those diets were made for people like some models who want to immediately shed some weight, who want to immediately get some cuts. And that is why it is important for you to understand that please do not be misled by other people trying to coach you, because use strategies that can work for you. Okay, so it is important that you make a community, you share your strategies with each other, and then decide on what a good strategy for you will be. And then everybody follows their own routine and then becomes healthy by themselves. Important thing is to reduce or quit consumption of alcohol and other intoxicants because they are completely dead carbohydrates, and it is important to understand the utility of high energy source food items like proteins, and reduce the consumption of carbohydrates and fats that slow your body down. And there are certain healthy ways of coping up with difficulties and daily challenges. Generally people so one of the major unhealthy way in which people generally tend to cope up with difficulty is going for smoking breaks. So whenever they are stressed, they're fatigued, they would like to go out and take a smoking break. Now, smoking break creates more and more and more and more and more anxiety because it creates dependency. If you reduce the smoking break and utilize the time in constructive activity, let's say playing some sport inside the office, because today these days many offices have table tennis tables, billiards tables, PS5, and so many things. So we can always do this to cope up with the difficulties rather than going for smoking breaks. Rest is important. As we discussed, sleep is important. So yes, rest is also important. Minimum 6 to 8 hours of sleep is very, very crucial for your body's development. And important thing is to keep in touch with family and friends. That helps you to reduce the stress on your mind, body, and soul, and give you a better outlook into the treatment and outlook into the society, which will help you in return to reduce the stress levels. Now, coming to the diabetes and hypertension, when we are trying to treat all these diseases, we should always make sure that the doctor is consulted as soon as possible. Because let's say you have an HbA1c of 6.1. Now, according to current guidelines, between 5.7 to 6.5, you have the pre-diabetic range. Now, if you have crossed the barrier and you've entered into the diabetic range, that is where you have to start thinking twice and work on yourself so that you are not at all, harmed by the long-term consequences of diabetes and hypertension. So diabetes, hypertension, cholesterol, they're all very, significantly systemic disorders that affect you from hair to toe and can affect any body, any organ, and create a problem with the patient. Like for example, diabetes. If you see from head to toe, you can have hair fall, you can have corneal ulcer, corneal all the what you call is cataract. Then you can also have loss of smell. You can have loss of taste. You can have tingling and numbing sensation of the face. You can have problems with the heart, like heart attack. Problems with pancreas, like pancreatitis. Stomach, which is constipation. Lower limbs, which is tingling and numbness. So diabetes affects almost every part of the body. Similarly, if there is hypertension, that also does the same. If there is dyslipidemia, then also there is the same. So we have a lot of diseases that are consequently trying to attack you, and if you are maintaining proper health and wellness, you will be able to sustain yourself even in these challenging times. So, as a summary, I would like to tell you that you can use a lot of supplements that are now available in the market to improve your stress, reduce the inflammation on your heart, and also increase your chances of weight loss and improve your sugar. You can take omega 3, L-arginine. You can take multivitamins if there is any deficiency, and you have to get on to a low cholesterol diet and do some weight loss in case you are overweight, just because you would like to get the best result out of your efforts, and the weight will always be an deterrent to your success. So I will repeat myself that fitness is not only absence of disease but complete mind, body, and soul satisfaction, which can create a healthy, fit body. Okay, I have some videos that I would like to show to you before we move on to our next segment.
Hi, I'm Dr. Niva Bupa, Chief Success Coach, a psychologist at Good Clip. At Good Clip, we believe true health isn't just about numbers. It's about how you feel, think, and live every day. That's why we bring together nutrition, movement, sleep, stress care, and mindset into one powerful personalized plan. We begin with your Good Flip metabolic score, your body and lifestyle decoded in one simple number. It gives us a clear picture of where you are and what you need. Based on that, we create small daily actions that fit your lifestyle, not the other way around. Because real change, it doesn't happen overnight. It comes from showing up meal by meal, breath by breath, thought by thought. That's where the magic happens. And I am here to guide you through it with personalized coaching backed up by powerful psychological tools like cognitive behavior therapy and mindfulness. These aren't just techniques, they help you break unhealthy patterns, reduce stress, sleep better, stay motivated, and feel more in control. Your journey isn't just about fixing what's wrong, it's about feeling right in your body, in your mind. You show up, and together we flip the script on your health. Let's begin. Hi, I'm Bushali Atravne, Chief Nutrition Coach at GoodFlip. At GoodFlip, diet isn't just about food, it's one of the five pillars of our care. Nutrition is a powerful tool to manage and improve conditions like PCOS, fatty liver, diabetes, thyroid, and many more. Your journey begins with GoodFlip Metabolic Score, a science backed assessment that looks at your medical history, lifestyle habits, and key biomarkers like inflammation and insulin response. This helps us set clear long term and short term milestones. Based on this, we design personalized diet plans, not just based on your weight or age, but also based on your blood reports, health goals, food preferences, allergies, lifestyle, and even sleep patterns. Your body evolves, and so does your plan. Every 15 days, we track your progress and assess how your body is responding to the diet. Make seasonal and goal based adjustments. Introduce new focus areas like gut healing, metabolism boost, detoxification, hormonal balance, and more. We are in this journey together. Your effort and our support makes all the difference.
Hi, I'm Dr. Bhavan Bausa, Chief Exercise Coach at GoodFlip. Movement is more than just workouts. It's step-by-step journey to help you feel stronger, healthier, and more balanced inside out. Movement through enhanced physical activity help us feel better, function better, sleep better, and manage health conditions effectively. Movement is unique to each person. There is no one size fits all approach. We help you define your own movement goals, tailoring them to your body, lifestyle, and needs. By following science backed guidelines, we ensure every step optimizes mobility, strength, and overall well being. We begin by adapting your body for progressive movement using gentle exercises that suit your needs. This approach enhances mobility, eases joint discomfort, and builds a strong foundation for long term strength and energy. You will start feeling lighter, calmer, and more energized. Next, we focus on balancing your hormones, helping stabilizing your mood and reduce cravings so you feel more in control each day. Then we work on improving insulin sensitivity and muscle mass, training your body to handle sugar better. So you experience steadier energy, fewer sugar crashes, and a more responsive metabolism. As your body adapts, we gradually increase strength and endurance training. These workouts, shaping lean muscles, boost metabolism, and help you feel strong, confident, and capable in your everyday life. And every 15 days, we review and adjust your plan, making sure it evolves with your body's need. Whether you are healing from injury, managing joint pain, or ready to level, managing health effectively requires exercise, nutrition, and behavior change working together. Functional movement boosts strength, while timing and pairing workout with the right pre and post meal enhances the recovery. Because it's not about quick fixes, it's about building strength, balance, and resilience that last. You show up, and I will guide you every step of the way. Let's make this journey count together. Hi, I'm Dr. Bhavan Bausa, Chief Exercise Coach at GoodFlip. At GoodFlip, movement is more than just workouts. It's step-by-step journey to help you feel stronger, healthier, and more balanced
Okay, so coming back to our discussion, as we noticed that when these coaches were talking, they were all focusing on very important point, that is movement, that is your focus, and that is your diet, nutrition, and your values that are inculcated inside you regarding fitness. See, as we discussed, exercise is only 20% of your fitness. The rest is what you eat is what you become. If you eat junk, you become junk. If you eat healthy, you become healthy. And what is healthy? Is eating bread healthy? Is an American breakfast healthy? Or is an Indian breakfast like aloo paratha healthy? No. Health is determined by the quantity of protein, quantity of carbs, oil, type of oil used, amount of salt used, and the freshness of the vegetable or any other or the food item that is being prepared. It is important for us to understand, the more we consume unhealthy food, the more we become unhealthy, but not only in body but also the mind, because our thoughts are channelized by the food that we eat. So coming to the utilization of your the effort that we are trying to put in with with our listeners, is that you have to understand that nutrition, psychology, and physiotherapy is important to manage health as a whole. And when people ask, where do we get all these things, there is nobody who's providing this as a as a unified product or a unified presentation. Hence, it is important for you to understand the value of consistency, and whether it is diet plan, stress management, or doctor consultation, it has to be done on a regular basis so that you can get the best results out of it. Now, that is why, Visit and Niva Bupa bring to you the Condition Management Program, which is also known as the CMP. And this program gives you continuous support, regular checkups, and personalized guidance with doctors, nutritionists, and physiotherapy experts at one particular place. The benefits are immense, such as holistic care, wherein you get diet, lifestyle, medical guidance, and it's all under one umbrella. Then there is convenience of meeting experts, speaking with them, getting their consult directly. The consistency becomes better because there is regular follow up and you can track your progress. And in the end, the result is that you have better control above your chronic diseases like diabetes, hypertension, asthma, PCOD, etc. So there is obviously, when you have the, if you go for the CMP, you go onto the Niva Bupa app, and there you can, fill the Google form and get in touch with the, the support staff who can coach you into how you can get into this program. And once you are assured that this is going to help you, you make sure that you do it with full enthusiasm and try to get along on a daily routine so that you can get the best of yourself. Now, the session is also open to questions. If you have any questions, you can keep putting it in the chat box. Meanwhile, I will open the chatbot phase. Okay, so we have our first question: how to reduce stress? So, as I mentioned, stress is everywhere. There is no place without stress. Stress will be at your home. If you got kids, spouse, parents, siblings, they will give you stress. If you're at work, boss, timelines, sheets, stress can be physical and emotional both. So there is physical stress of long distance travel to get to your office, sitting on a chair which is so so long term sitting on the chair, and so many things are there that you have to understand, that many times you are not able to focus on how these things will go on, and how long you have to fight to do this every time, right? So you have to understand that stress is going to be everywhere. It is about how you want to cope up with the stress. Like, I am a doctor, I have a surgery lined up, I have a webinar lined up. That's also a stress. I have to go and perform a procedure on a patient who is going to wait for me for some time. But I have a commitment to fulfill. That is a stress. It's emotionally draining, wherein you have to, speak for so long, interact with the audience for so long, and then perform a surgery with the best of your capability. Because if you don't do it, obviously the patient will suffer, right? So it is important for us to understand that stress will be everywhere, and you will not have any area where the stress is not there. Correct? Now, to reduce stress, you can always do a lot of different things. You can do, exercise, right? You can become you can become you can you can start doing meditation. You can start doing practices like wiggle maneuvers. If you see your throat, there is a small artery that goes from this side like this. If you just press it and you do like this, it creates a very soothing sensation. This is called as vagal maneuver. It is called as vagal maneuver. These vagal maneuvers are required by many, are practiced by many massage therapists. They do like this, they do like this, and this creates this soothing sensation that reduces your stress down. That is why when you do a lot of when you take massage, or when you go for a physical therapy session, there will be a time when they will do a lot of body movements on your shoulders and other places, wherein you will relax yourself, and you will feel much better. Mm, right? So we have our second question. Okay, we have our second question. What is the risk of eating too much processed food, and what are the risk of eating junk food? Well, that's a very very pertinent question, and thank you for asking that, Ujjwal. Because see, junk food contains a lot of saturated fatty acids. It contains a lot of trans fat. It contains a lot of monosodium glutamate, that is called as MSG. It also contains a lot of oil and unnatural food substances, like prohibited. Sometimes it contains prohibited food colors and prohibited these agents, flavoring agents, right? So they are one of the chief causes of cancer. And eating junk food does create a lot of problem with with the patients. If you've seen the growth in the cancer has been tremendous in the coming few in the past few years, and the growth in cancer patients has been tremendous. If you see the incidence of breast cancer, it has increased by close to 30% in the last 10 years alone. And the cancers are also becoming more and more and more aggressive and more rapid because of these problems, right? So junk food does cause this kind of issue. And also junk food does meddle with your hormones, and it increases a lot of, like in males, it increases testosterone, making them aggressive. And sometimes you can also become a little uh, slow. You can become obese, and also you can feel there is drop in your energy levels. Okay, so we have a question from Dipendra. Sir, I've thyroid. Will this program be helpful to me? Yes, of course. See, thyroid is the fuel of your body. When we are looking at thyroid, the better the fuel, the better the levels of your body's, like the better is your body's energy and existence. So If you have a car and you're running it on, let's say, there are 4 or 5 types of fuels. There is the normal fuel, then we have a 95 octane and a 100 octane fuel. So let's say you're running on a 95 octane fuel, you step up to 100 octane fuel, you do get better performance, right? So thyroid is same. If you have better psychological support, nutritional support, and physical support, then your body functions better because your thyroid levels become better, right? And thyroid levels are directly proportional to the amount of stress that you take, the amount of obesity that you have, or the amount of hypertension and diabetes that you have, because mostly all are autoimmune in nature. Okay. So we have one more question coming up. What is the best time to have meals every day? And if we don't follow the routine, what is the impact in our body? So if you see the normal human circadian rhythm, the best meal time is between 8 a.m. to 8 p.m. It is important for you to understand that your meals should be divided into 4 to 5 meals in a day, wherein the body starts with the heaviest meal of the day, which is breakfast. Then we come to a light lunch, I mean like a middle segment lunch. Then we have an evening snacks, and then we have a very light dinner. And that is how your food routine should be. So we have a question from Karan coming up, that he needs help with weight management. Yes, actually, weight is one of our targets, and it is also it should be it should be an eye opener to everybody that weight is definitely a very important parameter in managing fitness. See, there are metabolic parameters and then there are non-metabolic parameters. If we are looking at metabolic parameters, then we have the HbA1c value, fasting blood sugar values, HSCRP values that has to be looked after. But if we are looking at non-metabolic blood parameters, then definitely weight, stress, and other such things have to be looked after. So you will get a good weight management guidelines here, because you will be assisted by good nutritionist, good physical therapist who will help you attain a stable body weight. Okay, so we have a question from Richa, whether intermittent fasting is helpful or not. Well, yes, intermittent fasting is definitely helpful, but there are certain challenges to intermittent fasting. See, intermittent fasting has been happening not only now; it has been happening since many centuries. When you go through the literature of our history and ancestry, whether it is India or the Western countries, you will see that most people have always advocated that you eat your last meal by 7 p.m. and you eat your breakfast by around 9 a.m. Now, how many hours is that? Technically, that is 14 hours. So, is that not a form of intermittent fasting? It is. And these has been existent through many centuries. But we as humans, always have this habit of renaming everything again and again. And presenting it in a more and more sophisticated manner, so that it feels very I would say different. And then we would love to try it. Correct? So intermittent fasting helps. We have been using it, and we have always encouraged our patients to do such kind of fast the time duration of between the two food items, so that patients can have a good, natural, well built physique, because this will automatically help realign your body fat and redistribute your body fat into the right spaces. Okay, we have one question coming from Sujata ji. How to control insulin resistance? See, that's a very good question. I mean, insulin resistance is a big problem in recent times, when actually earlier polycystic ovarian syndrome was a disease of obese females. But with the increments in work life imbalance and the stress levels, it has now become a routine issue with many people, right? So it has now become a routine problem with many people. It is important for us to understand that insulin resistance is not only impacting your sugar, it is also impacting your the hormones in the body. For females, it leads to hair fall, facial hair growth, there is skin darkening around the neck, there may be reproductive issues, and there may be infertility as well. So insulin resistance requires very good control in stress, very good control over the fitness, daily exercise, and good intake of proteins. There are certain medicines which are also improving insulin resistance. You can get in touch with your gynecologist for the same. Now we have a question from Kaushal. What is the best time to have meals every day? And if we don't follow the routine, what is the impact on our body? So as I mentioned, the meals have to be split into three or four: breakfast, lunch, evening snack, and dinner. And if you don't have that, there is a chance that the body starts becoming bloated, the body starts retaining water, because if you don't give the food to the body when it desires the most, it will either starve itself or it will start looking for more options to get food from. Hence, if you are not taking care of your body, you will definitely start having a lot of external inputs of food, right? So that will create bloating, that may create water retention, and if you don't have meals every day on the same time or around, then it does create too much of an issue. ओके, सो यश इज आस्किंग, ये प्रोग्राम मेरी मम्मी की डायबिटीज कंट्रोल करेगा? बिल्कुल करेगा. बिकॉज द मोर यू वॉच, बिकॉज द मोर यू प्रैक्टिस ऑन दिस प्रोग्राम, the better it is for your family members. And if it does not cure or correct the diabetes, even after a rigorous effort that you will be putting on the on the fitness of your mom, then definitely it has to be also looked up by a physician, because there might be certain things which are genetic in nature, or something that is very wrong. Otherwise, in 90% of the cases, these kind of medicines can definitely work. So we had some really good questions. If there is anyone else coming up with a good question, please put it up on the group, and I will be happy to answer them. Meanwhile, let me tell you something also about how fitness can be linked to vaccines, because see, this is the era of multiple diseases happening. So if you see from the birth of the child, you have tuberculosis, diphtheria, tetanus, then you have hepatitis B, hepatitis C, hepatitis A. If you're traveling, hepatitis A is very important. Yellow fever is important. Then you have other, the extraction of other vaccines for other diseases like the COVID, influenza, and so on and so forth. Now, my question is, if you are falling ill every time, every year, you get influenza and you're not taking the vaccine, then in that case, you are reducing your fitness levels. You are bringing it down to such a level wherein you are not able to exercise your fitness at all. So it is important for you to understand that if you are a person who needs, I would say, who needs to be substantially active, who wants to be, productive throughout the year, should definitely get vaccines at the end of, at the important dates that are available. I will send it across to your HR, and you can, do the same and utilize the same in your household and communities, where you can do proper vaccination to stay fit. And vaccines are now available for most of the diseases that are communicable, whether be it pneumonia, be it influenza, whether be it typhoid or any more. So you have to make sure that you are, taking the right kind of medication and doing the right kind of consultation. So I think I have covered almost all the questions. There are few things which I would like to tell you regarding fitness. That when you are teaching, when you are discussing about fitness, don't discuss it as just an other fitness question or a fitness routine. You have to start it as a revolution inside you. You have to make sure that any fitness talk is never complete without you. If you are there, you are the brand ambassador of fitness yourself. Because the thing is that people are taking fitness very, very lightly. We as clinicians, we experience a lot of challenge when we have to see young people, 40 years, 45 years, and so on, get intubated, become so sick, develop COVID, pneumonia, pneumonitis. And when we get to know that they are not vaccinated, it is just that it pains so much that something that was so preventable, which could have been prevented, was not able to be prevented, and the patient has suffered. So, whenever you are looking at yourself in the mirror, daily ask yourself a question: am I fit? Ask yourself this question: am I fit? Am I fit? Because unless you ask yourself this question, they will never say they are fit. Okay? So, that is important. Now, coming to one very important part is the choice of food items that people ask me, what can they eat? What can they not eat? So, let's say you are obese and you have diabetes, then what will happen? So you are obese and you have diabetes. What should you leave? So you should leave all these tubers, which is basically sweet potato and cauliflower and so on and so forth. You have to leave these tubers and not eat them at all. Also, you have to start avoiding white rice, because white rice has direct starch content, and starch is definitely one of the leading causes of obesity and respiratory failure in diabetics. Okay. So Dipendra, thank you for being such a lovely listener, and thank you for if you've liked my guidance, and I will make sure that we are doing good business and in terms of helping the patients recover from their ailments. And when we are launching a program, it's not only about creating a good business. It's about creating value in the society. It's about creating so much of impact that every member is I would say enthusiastic and also determined that I want to stay fit now. I want to attain my fit body shape. I want to attain my wellness physique back. If I was in college and I was, let's say, having a waist of 28 inches, why not I attain a 28-inch waist at the age of 35 or 40? When certain film stars and actors even at the age of 65 can do it, why can't we do it? The problem is incentive. We are not incentivized to do it, right? So till the time we are not able to I would say reach that level, we should always try to focus on achieving success through multiple channels of achieving fitness. So what could be the multiple channels of achieving fitness? You could start with exercise, you could start with nutrition, you can reduce your stress, everything will help you. Okay? Everything will help you. It is important for you to understand the value of all of these efforts. So as a patient, please try to understand the value of these patients. I'm sure that you might have got a lot of knowledge till now. So I'll just do a quick recap on what we have gone through so far. And let me just share my screen. So, as we discussed, our primary health benefits, mental and emotional benefits, long term benefits. Then we discussed about how these diseases are interchangeable and correlatable. We discussed about stress and health. We discussed about your routines, exercises, and motivation. And we discussed about the pillars of wellness and tips to improve the health. Okay. So what I would like to now, focus your attention to is the of course, we are all here to understand wellness and health as a whole. And if you see I would say um, uh, the program, the condition management program in your Niva Bupa app, it is so very well designed that it will easily take all your medical wellness data and tabulate it into the requirement that you have. And it is always great to be amongst all our listeners and try to explain to them what is basically health and how they are helping it. Okay. So, one thing that we need to understand in the last is that you need to build a plan for yourself. And for that, you need to take proper guidance, make a plan, and then follow it every day. Okay. So, one last thing which I would like to add before we close the session is the utilization of your technology in your hand. How many of you generally tend to log in your meals to understand what is the what is the challenge that is not helping somebody stay fit? When we are looking at the challenge, then why somebody is not able to stay fit is because maximum number of times it is driven by a mix of diabetes and emotionality, and this together makes a formidable force which we will see in the upcoming days, wherein when we are looking at our program being managed, like our program managing our patients, we would see how they are going to enter into the system. Okay, so it is important for us to understand the value of good nutrition, good exercise, good food habits, and proper rest and sleep. Okay. So, if there are no more questions, we can close this session. And I would like to thank all my listeners who are there to support us, to feel enthusiastic, and and who would be determined to focus their daily routine according to the plan that they take. And once they are available, they are going to rock the world. So all the important links are posted in the comment section to the right, and please feel free. Okay. So thank you everybody. Thank you for joining us in today's live session. I hope you liked it. I hope you enjoyed it. And thank you so much for the wonderful questions that the team has asked, the listeners have asked. And thank you so much for joining us today. And I really pray that you will make somebody fit again. You will make certain iterations and the changes that are required to uplift the society from the the challenges of a poor fitness regimen.